Welcome to Spotlight. I'm Terry Harrington. I'll be speaking with Adam Mollan from Lake Huron Medical Center. And today's show is sponsored by the St. Clair County Department of Veteran Affairs. Well, Adam, it's hard to believe we're almost in November, and that means it's Diabetes Month. So I know that's something that's of concern for you, so tell us about that.
Sure. So Diabetes Month is the month of November, and we look at celebrating, kind of the advances we've had with diabetes care, and mostly supporting those patients who've been diagnosed.
Are we seeing an increase in the number of people who have become diabetics?
Absolutely. So St. Clair County has a very high rate of diagnosis of diabetes, as well as does Michigan. So we're seeing that year over year increasing exponentially.
Any reason why?
So there's some issues with, kind of lifestyle. There's also with genetics, but also we're just seeing that we're on the kind of positive side. We're diagnosing better, so we're catching people earlier than maybe would have gone undiagnosed for a long period of time.
Are we finding these are more in adults? Is it more in children or teens? Or?
So the primary increase has been in the adult side, but we are seeing an increase in both the adolescent and the teenagers, where we're seeing type 2 diagnoses, which were previously either uncommon or extremely rare, which is a concern, for us as healthcare providers.
And when we speak of diabetes, we usually think of those who have to take insulin shots every day. Can't imagine having to do that, but it's more than just that, isn't it?
Absolutely. So, there's a combination of options for patients with diabetes. They can have oral controlled with their doing diet and exercise. There's oral agents, there's injectables that are not insulin, and really a combination of all of those. And when we start adding in the other technology pieces, like we're seeing blood glucose sensors and algorithms, it can get very overwhelming for patients, and that's what we're here to do, is try to guide folks.
Now also too, if you're diagnosed with diabetes, is that pretty much a lifetime thing then that you have to control, or is that something you can kind of outgrow at times?
So kind of is my best answer for that. So what I would say is that a type 1 diagnosis is for life. A type 2 diagnosis is more or less for life, but what I would mean by that is if you're very successful with weight loss, with lifestyle changes, some patients can come off of their medications. However, I always caution patients to not think that they're in the free and clear. I want them to make sure that they still consider them as having diabetes treated by diet and exercise rather than having been cured, because I've seen folks where they kind of lose that focus a little bit, and they start, those numbers start creeping back up.
So what are you doing at Lake Huron Medical Center to address this issue and to help our community?
Sure. So we do diabetes education services. Those are something that as an outpatient you can come in for classes. We have support groups. We have resources available to patients as far as blood glucose monitoring trainings and those types of things. And then also we're looking at doing some more screening events and kind of outreach in the community.
And you have a big event coming up. Tell us about that.
We do. So the Sugar and Spice event is November 2nd from 10 to 12. And that event, we're going to do a combination of free screenings. So we're having blood work, urine tests, eye exams, and foot exams. And then also having educational components with a dietitian, with like a sample meal, sample dessert, very small samples. And then also the RNs and weight loss coach there to try to go over, what are those burning questions or things that maybe you don't know.
And it really is diet and your weight and lack of or exercising and all that really plays a big part in all this, doesn't it?
Absolutely. So your physician, a lot of times the physician offices are really well managed to take care of the medication side, and that's where we're kind of there to kind of supplement, because it isn't just medications. We also want to make sure we're addressing those lifestyle changes, because that's where we see the best outcomes for patients, is when we're tackling it from all angles.
And when you're doing it in a silo by yourself, you're not as apt to be as successful as if you have a group around you.
Absolutely. And we also see patients where they think they're doing the right things, but maybe they're making way more work for themselves than they have to, or maybe they're doing things that just the data isn't maybe as clear as they think it is when they're making these choices.
Now, if somebody's diagnosed with, let's just go with not number one with the insulin, but diabetic 2, Is that a huge lifestyle change that they have to make, or is it kind of subtle that the changes that they need to make?
So ideally, we like to have a conversation point with that patient at that time. So it depends on kind of what else is going on with that diagnosis. Some patients are diagnosed very early with no complications, no comorbidities, and it's something that we could make maybe some mild lifestyle changes, versus that patient that's in the hospital maybe having had a heart attack, and this is the first time they've realized they've had undiagnosed diabetes. But in general, what we're looking for patients is 5% weight loss. We're looking for an increase in activity, which includes walking, So patients go and they think, well, I have to be more active, like I can't go to the gym, I can't run on a treadmill. Can you walk for 5 minutes more than you were doing already? Something very small.
Okay, great. So again, tell us about the Sugar and Spice event coming up. When, where, how do people register?
Sure. So it's at the Lake Huron Medical Center North Campus, which is located at 4190 24th Avenue in Fort Gratiot. And all they would have to do to register is give us a call. We'll just want to collect their name, their birth date, and then their physician, because we're going to be giving all this information to their primary care doctors. And the number that they would call is 810-216-1840. And once they call there, like I said, it's a very brief interaction, and then we're setting up 2 time blocks from 10 to 11 and 11 to 12. And then it's just kind of an a la carte. So if they want to do one piece and not all of them, that's perfectly fine by us. And we'll just have folks in the lobby of the North Campus to direct them to where the different sites are.
And there's no cost for this?
There's no cost. It's free for the patients.
Somebody said, Adam, why should I consider coming? What would you tell them?
So I think the biggest thing is that, if you're maybe hesitant to have had these checkups, you're not sure. There's a lot of patients with diabetes who are living in the unknown because they're afraid of what the answer is, right? Also just that patient that's very frustrated, that you have a lot of issues or barriers. There's going to be a lot of experts there that are really going to be able to kind of help guide you, on the right path.
Great. Well, Adam, thank you for telling us about Sugar and Spice.
Well, thank you so much.
And we want to thank you for joining us on Spotlight.